Thank you for staying with us. Now, the federal government says the suit it instituted against striking resident doctors will only be dropped when the doctors return to work. Minister of Labour and Employment Ngige stated this on Sunday after meeting with President Muhammadu Buhari in Abuja. The minister revealed that the government has agreed to meet the 12-point demand of the resident doctors, but insisted that the no work, no pay policy enshrined in Section 43 of the Trade Dispute Act will be enforced. The resident doctors have been on strike for the past 1 month over irregular payment of salaries. Amongst other issues, efforts of stakeholders, including the House of Representatives, to intervene did not yield desired result. Joining me now is clinical pharmacist and public health expert Insa Abasi Ekanem. Good morning. Thank you for joining us.
Good morning. Thank you for having me.
Now, this is the recent development with this matter. Doctors are insisting that, resident doctors rather, are insisting that this clause, the no work, no pay policy, has to be taken out. But government is saying since it is enshrined in the Trade Dispute Act, it will be enforced.
Well, I've gone through the document, the Trade Dispute Act, and I know, of course, in Section 43, it is stated that if a worker or an employee withdraws his or her services from an employer, that the employer has the right to withdraw the remuneration. And of course, can use that to pay maybe any other person who stood in at that time. But, you know, I feel that in this case, we need to toe the middle course. As much as we are trying to satisfy what the doctors have said, we know that there are a lot of unions in the past, all right, who went on strike, and this particular act was implemented. They were not paid. Lecturers in the university, we had JOHESU, Joint Health Workers Union. And, you know, my fear here is this. If we probably overlook this and say, okay, well, these are doctors, let us see how we can probably boycott this rule, you'd see other people coming up. Other unions would definitely come up and say, look, we were not paid when we went on strike, and now you want to pay these people. Tell us why. I mean, and this might lead to another set of crisis, because I know that there are a lot of other unions that are waiting to see how the government will handle this issue.
Absolutely.
And then if there is any form of partiality, I can assure you that these guys will come up, and that is not what we need at this time. I want to really probably call on the National Association of Resident Doctors that, look, the government has, according to President Ngige, you know, the issue that we have right now for me is the fact that many times, government renege on their promises. And that's why you keep seeing this incessant, you know, back and forth. But if the government is true to their words that all the 12 issues have been addressed, all right, then I just feel that the resident doctors should go back to work. Let's see how we can rescue the system, because the medical profession is not just about money. It's not just about that. It's about saving lives, all right? And if the government has satisfied the 12th agenda, a point agenda, and they're saying, look, we cannot pay because there is already a standing rule, and it has been served, the same act, the same rule, the same principle has been served to other unions. I just feel that the resident doctors should be willing to forego and let us move forward. Let us see how far the government can satisfy some of these conditions. After all, in this condition, you see payment of remuneration, payments of allowances. In 2014, back in those years, right, is part of the demands. And the government is saying, okay, we are going to meet these demands. I just feel that we should bury the hatchet and move forward. Let's forgo. There are some things in life you just have to forgo.
So you think perhaps the element of trust is what is the major issue?
Yes, I think for me, that's the main issue, because we know several times the national resident doctors have been on strike.
Yes.
And most times after they sign it, that a memorandum of understanding, memorandum of action, or every kind of memorandum. In fact, it is sometimes in Nigeria you get to know that there are lots of memorandums. I mean, so you know, I feel that the government should be true to their word, so that this our employers, also our employees, our government workers can begin to trust the government. I'm even hearing that there are rumors that ASU will still go back on strike. Right. So yes, so you see, this is a time where the government has to probably look inward and look at how we can probably draw in investment. Because I said this thing the last time I was here, that the government alone cannot finance the health sector. There's no country in the world where the government solely finances the health sector. We have other you know, partners. We have the private sector, we have the social sector. I think the government needs to engage these stakeholders adequately and see how we can, both the public, the private, and the social sector can contribute towards funding of the healthcare system.
Perhaps,
that's what I feel.
Perhaps that will be part of the conversation. You know, the president just set up a committee headed by the vice president. He set up a healthcare reforms committee, or rather to review all healthcare reforms adopted in the past 2 decades and factor them into development of the new health sector reform program. So perhaps this will be part of the conversation that the vice president will be having, because this involves the public sector, the private sector, representatives from the National Assembly. We have the Vesta Healthcare Partners and Bill and Melinda Gates Foundation as part of it.
Exactly.
So perhaps funding that would address issues of strike and other issues that will not have to be seeing all of those issues might be part of it.
You know, in the national health policy, all right, you know, there is what we call human resource for health, all right, that looks at remuneration, welfare for healthcare workers, not just doctors. We have pharmacists, we have nurses, we have lab scientists, we have a lot of them. Now, in that document, it was stated clearly that, you know, as much as possible, the government should, and relevant stakeholders should be committed towards funding of healthcare sector, which would be used for, first of all, human resource for health, mobilizing adequate human resource, of course, health commodities, health infrastructure, amongst all other things. Now, I just feel that what we should do is that we should be willing to bring, like you said, these stakeholders together and say, look, these are the thematic areas that we want to address. Let us see how we can address the critical aspects of these thematic areas, whether it is health, human resource for health, whether it is in terms of health commodities, whether, because sometimes we even hear that a lot of some health commodities are in short supply. For example, there was a time that we had a stock out of HIV medication, antiretroviral medication, and you know that shouldn't be the case.
At all.
So we have even issues, access to diagnosis is probably one of the issues that we also have. So these are some of the thematic areas that we should be able to list. And I believe that this committee, you know, set up by our president, should look at these areas, identify the core issues, and look at how the policy provisions for these, and see how the government can implement this. Like I said, the government will not implement this alone. That is why we're having these stakeholders. And I know that Bill and Melinda Gates has been committed. I mean, for several years in Nigeria, not just in Nigeria, but a lot of low and middle income countries, to see how this health system can be strengthened. So it's important that we bring all these stakeholders together and look at these critical areas and ways we can actually address them holistically. So that at the end of the day, we'll not see what we saw a few weeks ago, where doctors are eager to leave the country. You could recall that in the 1960s, I mean, the people from other countries in Saudi Arabia, the royal family came to University College Hospital in Ibadan to seek health care. Now, I mean, what has really changed? Have we changed priorities? Now, in 2000, many years ago, the Abuja Declaration, I mean, they demanded at least 15% should be committed. For me, I don't think 15% is too is too much that we can actually commit into healthcare, because you need a healthy nation for a productive nation. If everybody is sick, nobody will work. If nobody is working, the government cannot even realize income. So we need to secure the health of the nation. Now we are battling with COVID-19 pandemic. We've seen a lot of deaths. We are now battling with cholera outbreak. And there is even another pandemic that is even announced around Africa, which we want to see how we can strengthen our health security system, surveillance, and ensure that we step up our preparedness towards this. How can we address this when we have a chaotic health system? It's important that we look at all of this holistically, and then we build a health system that is formidable. And let me put it this way. It is important for Nigerian government to prioritize certain things. And I believe that health is one of those things that should be prioritized.
Does it, from what we have seen between the government and the doctors, does it show that we haven't prioritized health? Is that what you're saying?
For me, I would say that we haven't given priority to health. We haven't. Because if we do, there are ways we can probably come in. We shouldn't have allowed doctors to stay this long. If we knew that at the end of the day, we are going to still meet their 12-point demand, we shouldn't have allowed it this long. All we should have done is, okay, let us see how we can make commitments. And I'm saying this. Sometimes you need to start from somewhere. I looked at all the 12 demands. You see, some of them were even having influence on, medical consultants. I saw some about house officers, yes, and even other healthcare workers. Even the hazard allowance. Is it not so sad that for 30 years, the hazard allowance for doctors is 5,000 naira? Now, 5,000 naira, I don't know how much that is in dollars, but I don't think there's any country in this world, even a middle-income country, that is paying hazard allowance of 5,000 naira. There is no way it's happening, because they understand that every day doctors put their lives on the line. We have what we call the money that is paid to doctors who die in active service. So we know some of the doctors who died in the course of fighting the pandemic.
Absolutely.
Now, it will be interesting for you to know that some of those doctors, nothing has been paid to the family, which is not supposed to be done. So, because it deters other doctors. So you expect me to go when I know that the person who died fighting this pandemic, there was no form of remuneration to the family, there was no form of compensation. You think that I would go? No, it's not possible. We need to make sure that we show an example. If we can really empathize with these families, then we should be able to provide this.
Perhaps this is why some persons are saying, because I had a guest yesterday who was saying that perhaps it is time now for the association to begin to look into their demands in terms of have projections. At the time when it was 5,000, maybe the value of the naira was still something that we could say was worth it at the time. And if they are increasing it to perhaps 50,000 naira at this point, maybe in the next 10 years, 50,000 naira, nobody understands, the dynamics of what it can be when it comes to the value of our currency. That perhaps we need to begin to look into these things and make projections if you are saying you are fighting for a cause.
The Ministry of Labor and Employment, all right, has a department that looks into remuneration, all right, allowances and all of that. This is not the first time doctors are calling on the government to review the hazard allowance. This is not the first time. We could even recall that it was even in the heat of the pandemic that doctors were clamoring for hazard allowance. Yes. That was last year. And a prominent person now said that what do they do apart from checking temperature? So this is not the first time. As at last year, we know that 5,000 almost meant nothing in this country. And the government still did not look at that. You're right to say that, yes, there's need for that projection so that we can be able to, we will be able to, put some of these demands forward to the government in good time. But then I also believe that the Ministry of Labor and Employment should be doing a yearly review It is only in Nigeria that you don't see those yearly reviews. I mean, there should be a yearly review. And in the face of the pandemic, I mean, honestly speaking, in other climes, you don't even need doctors to start striking for you to realize that, look, these people put their lives on the line.
But there were promises made by government, I think sometime last year.
Yes, but those promises were not kept. That's the issue. In fact, the main issue around industrial action, not just for doctors, but for all unions, is the fact that the government easily renege on its promises. And that's why these people don't get to trust the government. Sometimes even the government will go as far as probably filing a suit in industrial court. But how long are we going to continue this way? If the government is not going to meet the demand, there's a polite way, there are better ways of explaining to these people that, look, at this time we cannot meet this demand. But look, we are working on something. And let these people also see that the government is making tangible effort. But when the health sector, key players in the health sector look at the fact that there's no increment in the budget. You can easily predict that there's really nothing different in what is going to be going to the health sector. We need to see a lot of people were shocked to their marrow that after a deadly pandemic, a very devastating pandemic.
We are still in a pandemic.
Let me put it this way. In the midst of the pandemic, in the heat of the pandemic, a budget was passed, and we still saw a paltry percentage allocated for health. I felt, for me, in fact, I was as sure as tomorrow that the 2021 budget will have nothing less than 15% earmarked for health. But when I saw the budget, I was a bit disappointed. But then I knew that, well, I was expecting that if the government cannot fund up to 15%, that I wanted to see a lot of private sector involvement, like we saw in car COVID.
Yes.
Do we need? My question is, if we could make that kind of that level of involvement in the heat of the pandemic, in car COVID, that means that really we can actually muster up stakeholder support to improve the delivery, the funding of the health
Perhaps
system.
we need to begin to put structures in place that will ensure transparency, because that was a major challenge as well.
Exactly.
Transparency, and we can have that engagement with the private sector.
But I think we have a lot of watchdog organizations in this country. We have ESPAN. ESPAN actually looks into global fund.
But what has that resulted into at the end of the day?
Well, the issue here is that sometimes some of these watchdog organizations, are not properly funded, all right? Because you also need to fund, there's what we call who watches the watchman, right? Who watches the people that are implementing these projects in Nigeria, these, programs in Nigeria. ESPAN is one of those organizations that does that. Now, I remember there was a time, my NGO, Trinity Healthcare Foundation, we went for a training, to monitor a budget, to monitor implementation of health budget, and also to carry out need assessment in the society, in the communities, in specific communities, to know what they need, so that we can advise policymakers and, of course, project implementers on how to meet the needs of the people. Now, unfortunately, some of these organizations, when we're poorly funded, at the end of the day, there's a limit to what they can do with the funds available. So I believe that, like you said, if we improve accountability and transparency in the delivery of health programs in Nigeria, I believe that we will see better results. And then that will encourage a lot of partnership, a lot of investment, both from the private sector and the social sector. Because if you see your money working, you want to invest more.
Absolutely. And then we wouldn't have a situation where doctors go on strike, and we see a Johesu also threatening, but government is going to be meeting with them today. What do you think should be at the front burner of that conversation?
I think what should be paramount in that conversation is, how do we work together? In the health system right now, there's a lot of, crisis. Power play. This is not what we expect in our health system. Okay, so Johesu is waiting at the corner. Let's see what the government will do to the doctors. As soon as the government probably satisfy the need of the doctors, the Johesu will come up. No, I think there should be a joint, it should be, in fact, I want the government to set up a committee that looks into the remuneration, allowances, and emolument of healthcare workers. And everything should be done with the highest amount of fairness. All right? If what is good for the goose is good for the gander.
Absolutely.
So whatever you have done for doctors, also look at ways you can probably work on the remuneration of other healthcare workers so that you don't cause that large disparity. Because one of the things I see in the Nigerian health sector is the fact that there's a lot of disparity without any explanation. So some people feel that they are cheated. Some people feel that they are relegated. That is not what we're supposed to see. What we're supposed to see is that, okay, well, this is what doctors are earning. This is the reason why. This is what pharmacists are earning. This is the reason why. This is what nurses are earning. This is the reason why. So that these people will understand the rationale for whatever they take home. You know, so that they will not start seeing that there is a lot of superiority and all of that in the health system. The health system should be working together. All health professionals should be working together in the interest of the patient. And so when you see that disparity, I mean, you begin to see people grumbling, you begin to see that, resentment in handling patients. So you see nurses complaining, how much are they paying me? You know, pharmacists are also complaining at the other end. But there should be that understanding, and there should be that deliberate effort to make sure that the health system in this country is strengthened. So I feel that there's need, and I hope that in that meeting today, what we should place importance on is the fact that let us have an understanding, and let us understand why the salary scales. We have the CONMES, we have the CONHES, consolidated medical salary scale, we have the consolidated health salary scale. We need to make vivid explanation as per why we have these different salary scales so that everyone will be on the same page.
Absolutely. Clinical pharmacist and public health expert, Nse Abase Kane, thank you so much for your time.
You're welcome.